in Tripura Medical College, and Dr. BRAM Teaching Hospital, Tripura. So, Dr. Kaushik, welcome to this session. Please start your session. Thank you very much.
Good afternoon, madam, and good afternoon, all respected faculties and postgraduate trainees. I am Dr. Kaushik Nag from Department of Community Medicine, Tripura Medical College. So, though I am very new in this domain of systematic review and meta-analysis, and I am very much thankful for PJIMR Chandigarh and especially Professor Minu Singh, madam, for inviting me to conduct this session on this systematic review of intervention. So, I'll try to tell whatever I have understood and whatever I can deliver in my short period of this lecture. So the content, is the slide visible?
Yes.
The content of my presentation will be introduction, formulation of research question, aims of reviews of intervention, then searching of literature, then process of selection of study and data extraction, then assess quality of article for risk of bias, synthesis and summary of result findings, then writing of report and methods. At the last, I'll show the methods for structuring systematic review, which we are working on. So I'll give you a glimpse of that systematic review. To start with, introduction. Systematic review addresses a need for health decision makers to be able to access high quality, relevant, accessible and up-to-date information. Systematic reviews aim to minimize bias through the use of pre-specified research questions and methods that are documented in protocols. Systematic reviews should be conducted by a team that includes domain expertise and methodological expertise. And good data management, project management and quality assurance mechanism are essential for the completion of a successful systematic review. Now the question comes, why do we should do a systematic review? A systematic review attempts to collate all the empirical evidence that fits pre-specified eligibility criteria in order to answer a specified research question. And they aim to provide users with a balanced summary of the potential benefits and harms of intervention and give an indication of how certain they can be of the findings. They also help to compare the effectiveness of different interventions with one another and so help users to choose the most appropriate intervention in particular situation. So whatever the content I have taken is mostly from the Cochrane handbook by Higgins. I will give the reference at the last part of my presentation. So most of the content are from that book and another book of biostatistics by Professor Indranil Shah and Bobby Bowman. And so there are many expectations, there is 11 expectations for conduct of intervention review. First is formulation of the review question. First of all, we have to identify on which topic we want to do the systematic review. That will be according to the choice of the author. So one criteria is there. I think most of you know this criteria, final criteria. So final criteria is used to formulate a question. So what does it mean, final? Final means it should be feasible for the researcher, I is interesting, N is novel, E is ethical, and R is it should be relevant. So this criteria is used commonly whenever we are formulating one review question. Next expectation is considering potential adverse effect. So these are all expectations for conduct of intervention review given by the Cochrane. Next part is what is the aims of review of intervention. The aim is to investigate the relationship between the size of an intervention, effect and other characteristics such as aspects of the population, the intervention itself, how the outcome is measured or the methodology of the primary research studies included. So this is the aim of review of intervention. So here we have to investigate any relationship with the intervention with the outcome. as well as any other characteristic such as any aspects of the population, intervention, and how the outcome will be measured. Outcome may be, in case of survival, it may be death, it may be improvement in quality of life. That depends on the research question. Next is we have to predefine the objective, which is also mandatory whenever we are formulating one research question. So we have to predefine the objective, and in deciding that objective, we should follow the PICO format, where the P denotes population, I is intervention or sometimes exposure also, and C comparison, and O stands for outcome. Sometimes we also include T, that is PCOT. T is the time frame from which this the research should be conducted. So this format, PICO format, that is population, intervention, comparison, and outcome, we should follow whenever we define objective of a research question. Next expectation is we have to predefine unambiguous criteria for intervention and comparator. That is, we should be specific. We should define the specific criteria for intervention and comparator group, and it should be defined in advance the eligible intervention and the intervention against which this can be compared in the included studies. So during deciding the types of interventions, factors we have to consider, like what are the experimental or control, that is comparative intervention of interest. Then does the intervention have variation, like example dosage or intensity, mode of delivery, personal who will deliver it, then frequency, duration or timing of delivery. So these things we should keep in our mind whenever we are deciding the type of intervention. Then are all variation to be included? For example, is there a dose below which the intervention may not be clinically appropriate? Will all providers be included? So this thing we have to keep in mind whenever deciding types of intervention. Then will studies including only part of intervention be included? That is also important thing before deciding types of intervention. Then will studies including the intervention of interest combined with another intervention, that is co-intervention. Then have the different meanings of phrases such as control, placebo, no intervention or usual care been considered. So these are the factors whenever we decide types of intervention on which we should do systematic review, we should consider. There are other expectations for conduct of intervention review. One is clarifying role of outcome. What is the outcome we want to measure? Whether it is in terms of survival or whether we are seeing the hospital stay in a indoor patient, or whether there is improvement in their quality of life, whether there is improvement in survival or whether there is death. So we have to clarify the role of outcome, predefine outcome domains. We have to choose our outcomes before conducting any systematic review. At the last part of my presentation, I'll give one example of our systematic review so that it will be more understandable. Then predefining outcome measures. So these are the things we should, regarding outcome, we have to predefine before conducting a systematic review. And systematic review should aim to include outcomes that are likely to be meaningful to the intended users and recipients of the reviewed evidence. So it should be useful, otherwise there is no point of doing one systematic review. So whatever systematic review we want to conduct, that should be useful for the common people and also the policymaker, whoever dealing with that particular topic. Next part is determining which study design to include. So we also want to predefine the study design before conducting any systematic review, defining advance the eligibility criteria for study design in a clear and unambiguous way with a focus on features of a study design rather than design levels. Then we have to justify also the choice of study designs. Then mostly we do for randomized trial, but if the randomized trials are not available, then we can do for other types of study design like non-randomized trials, also case control and cohort studies. So including randomized trial as eligible for inclusion in the review, if it is feasible to conduct them to evaluate the intervention and outcomes of intervention. So next part is when to include non-randomized studies. So when randomized trials are unable to address the effects of intervention on harm and long-term outcomes or in specific population of settings, then we can add this non-randomized study. Then for intervention that cannot be randomized, like for example, policy change introduced in a single or small number of jurisdictions. So in that scenario, we can include non-randomized study also. Next part is searching and selecting studies. So review authors, whoever are part of this team of systematic review, so they should work closely from the start of protocol with an experienced medical or healthcare librarian or information specialist. The Cochrane's Central Register of Control Trial, that is central, and Medline together with Embase, if access to Embase is available to the review team, should be searched for all Cochrane reviews. And some terms like a match, that is medical subject heading entry, are used whenever we search. I think searching of this literature was done in earlier classes. So planning is important, planning the search, then searching general bibliographic databases and central. There are lots of databases are there like PubMed, Embase, Cochrane. So search the Cochrane Review Group's specialized register internally via the Cochrane Register of Studies or externally via the central, and ensure that central, Medline, Embase have been searched. If the Embase is available to either the Cochrane Review Group or the review author, then that can also be searched. With sources to search. In general databases such as Medline, a search strategy will typically have three sets of terms. First is term to search for the health condition of interest, that is the population. Then terms to search for the intervention evaluated, what is the intervention we want to see. And third is term to search for the types of studies and to be included. So these are the key things whenever we want to search in Medline or PubMed, Cochrane, Embase. So we should look into account these three things. One is population, what is the intervention we want to search, and also the type of study design. So this is one study that was on that is a treatment that was treatment with hydroxychloroquine, azithromycin, and combination in patient hospitalized with COVID-19. So that was one study which we searched in our preparation of the systematic review protocol. So just I have taken one snapshot from that. Next is typical process of selecting studies. So what are the typical process of selecting study? First is merge search results from different sources using reference management software. We have different reference management software like EndNote, Zotero, and remove the duplicate records of the same report. Examine titles and abstracts to remove obviously irrelevant reports. Then we have to retrieve the full text of potentially relevant reports. And then we have to link together multiple reports of the same study. Then examine full text reports for compliance of studies with eligibility criteria. then correspond with the investigator where appropriate to clarify study eligibility, and last is make final decision on study inclusion and proceed to data collection. So these are the thing whenever we are selecting studies we have to keep in mind, and we should remove any duplicate study from the search so that there is no duplication of research study in our systematic review. So here one Prisma, it is preferred reporting of items of systematic review and meta-analysis. Flow diagram is there where we can see there are different databases like Embase, Medline, clinicaltrial.gov, MedRxP and Cochrane library. From this they have collected, that was one systematic review of chloroquine and hydroxychloroquine as treatment of COVID-19. So they have, it was done by Chaudhary et al. So they have searched different databases, and from this they have analyzed around 340 total abstracts. And after analysis, they have eliminated around 274 studies. Then they have finally analyzed 66. Among these, total clinical trials were included was 7 and total pending clinical trial was 29. So this is one flow diagram, how whenever we are reporting one systematic review for publication, then we have to give this Prisma flow diagram in our methodology part. Then selection of studies and extracting relevant data. So after merging the search results from different sources and removal of duplicate studies, the researcher should proceed to examine the titles and abstracts to remove studies and documents irrelevant to the research question. And whatever the abstracts that is going in direction of our research question, then that study we have to extract the full text. Full text of selected studies should be retrieved. Then softwares for managing selection process. There are different softwares. One is Abstractor, one is Covidence, one is Distiller, SR, then EPPI Reviewer, then Ryan. These are some software for managing our selection process. And data extraction is a very hectic task, and it should be ideally done by 2 to 3 independent reviewers. And it is very time consuming also. So 2 to 3 reviewers should do data extraction of one review, and then they will correlate the findings with one another. Then what are the things they should include in the selection of study and summarizing the relevant data? The information they should include is the study design, setting, year of study, the author, participant characteristic, the intervention they studied, the length of follow-up, outcome data, adverse event. So this thing should be extracted in a data extraction form. I'll show the one data extraction form also. Then researchers can avail various data extraction software like Excel, Covidence, Revman, then SRDR, that is Systematic Review Data Repository. So these are some data extraction softwares are there, where Revman is freely downloadable, and others I think some subscription charges there. By this we can conduct our data extraction and synthesis part. Next, assess the quality of our studies for risk of bias. So risk of bias assessment is done to eliminate bias like in flaws in sampling, randomization, then any overestimate of intervention effect. So this is a separate class I think that will be dealt in later part of our this course. But it should be done by 2 to 3 reviewers, like data extraction it should be also done by 2 to 3 reviewers. And various quality assessment tools, that is risk of bias tools are there. One is ROB2 Cochrane tool, which is mainly for randomized control trial. One is Robbins one tool, Robbins side, that is risk of bias in non-randomized studies for intervention, that is done for non-randomized control trial. NIS tool for observation and cross-section study, then Quadus 2 for diagnostic study, then CARE tool is for case report, and Toxer is for in vivo and in vitro. I think few of the tools will be discussed in later classes. Next is in summary of findings. What are the things we should incorporate in summary of finding table? So first is salient information about the population and setting of selected studies. Then description of comparative parameter or independent variable influencing the outcome. Then overview of the most critical and or important health outcome, both desirable and undesirable. Then estimate the burden of each outcome. Absolute and or relative magnitude effect of each outcome. The number of participants and studies contributing to analysis of each outcome. And grade assessment, that is grading of recommendation, assessment, development and evaluation, assessment of overall certainty of body of evidence for each outcome, and lastly any comments or explanation evidence. So these are the things that should be done in for summary of findings table in each systematic review of intervention. Next is writing the report. In writing the report of systematic review, we have 4 sections. One is introduction part, then in methodology part, then result part, and lastly discussion with the conclusion part. And study characteristic table should be there in a systematic review, and PRISMA, that is preferred reporting of items for systematic review, and meta-analysis flow diagram that I have shown in earlier slide also, that should be included in this preparing the report of a systematic review. So there are different reporting standard. One is the most commonly we use PRISMA, that is preferred reporting items for systematic review and meta-analysis. So here 27 items are there. I'll show in the next slide a few of the items. Then PRISMA P is another standard for the protocol of systematic review. Then PRISMA IPD is there, that is for individual participant data. Different standards are available. Then PRISMA SCR, that is for scoping of reviews and evidence map. And Equator is a network where multiple guidelines for systematic review are there. All the guidelines of this reporting formats also can be downloaded from this Equator, that is enhancing the quality and transparency of health research network. So here you can see, though it is not so much visible, so different items are there. Total 27 items. First is title, then abstract, then introduction, then methods. In methods, there are lots of subheadings: eligibility criteria, information source, search strategy, selection process, data collection process, data items, then study risk of bias assessment. So all these things we should, whatever the study you are doing, so we have to fill all the items from those included studies in our study design. Then in result part also there are lots of subheadings like study selection, study characteristic, risk of bias in study, result of individual study, results of synthesis, recording of bias, and certainty of evidence. So all those points we have to take in account whenever we are doing this systematic review. Then next part of after result is discussion and other information. So all those things, this around 27 items are there in PRISMA checklist, we should fill whenever we are conducting one systematic review. Then next I'll show one study which systematic review we are doing, and we'll discuss that also. What are the points we can of their systematic review we can describe. That was one study of effect of hydroxychloroquine and azithromycin combination used in COVID-19 patient. That was prepared from our college, Tripura Medical College, with help of Professor Minu Singh Madam and Mandi Singh, and it was registered in Prospero also. And if we uh, divide now this study in our PICO format, here the population of our interest is COVID-19 positive patient. And the intervention we look is hydroxychloroquine and azithromycin combination use. And the control group will be any other modes of therapy given to patient. The outcome will look into this systematic review. One is your viral clearance measured by RT-PCR. Then any adverse event following this combination. That is regarding septicemia and also death due to any cardiac disease, respiratory disease, or multi-organ dysfunction syndrome or any other. In time frame, we selected 12 months for this. Study design we thought to include randomized control trial, non-randomized also, and retrospective cohort study also, because that at the time when it started there was not much RCT on this topic, so we have to include other study design also. And criteria for excluding studies, which studies will not include, like other language study than English, and if the full text is not available, so these studies will be excluded. The search method will be Prisma. Guideline will be followed for study design, search protocol, screening and reporting. And different databases like PubMed, Scopus, Embase, Cochrane Library, Web of Science, Google Scholar will be used for searching of literature. Next is contribution or responsibility of researcher. First is in title and abstract screening, so it can be done by 2 to 3 reviewers. They will search the studies which are related to our research question, that is effect of azithromycin and hydroxychloroquine on COVID-19 patient. Then searching of literature will be done also by 2 to 3 reviewer, where the librarian should be there because they are expert in this searching of literature. Then data extraction is also another hectic task which needs around 2 to 3 months. So that should be also done by 2 to 3 reviewers. Then data synthesis and meta-analysis we have to do. That should be done also by 2 to 3 reviewers. And lastly, after finishing our data synthesis and meta-analysis part, we have to draft the manuscript. So methods in review. So in methods, 3 main review authors will independently extract the data from eligible trials using an agreed form, and any discrepancy will be resolved through discussion or through consultation with the 4th author or 5th author if required. Quality assessment can be done by any risk of bias assessment score like ZR scale, Robbins I tool, Newcastle Ottawa scale, checklist, and also other ROB2 is also there. So whatever study we will include, according to this, we'll choose our risk of bias assessment tool. Data extraction I have also discussed in earlier slide also. Parts of study like methodology, results, abstracts will be extracted for analysis of outcome. The name of the first author, publication year, region of study, number of patient, number of control, mean age, treatment option, medication, dosage, treatment duration, adverse effect, then radiological results, safety, nasopharyngeal culture, status through RT-PCR and mortality, everything we have to include. And if there is any confusion about the information we found in any study, then we can also contact the author of the original research article. And also during analysis, we can use the RevMan, that is Review Manager Software 5.3, which is freely downloadable from internet, from Cochrane, that you can use. Next is methods for assessing risk of bias. So methods of randomization that can be done during any risk of bias during method of randomization, treatment allocation, blinding procedure applied in trial. Then assessment will be done at both study as well as outcome level. And 3 review authors will independently assess the risk of bias for each trial using Cochrane collaboration tool for assessing risk of bias. And if there is any disagreement, that will be resolved by discussion or by involving a fourth or fifth assessor. Uh, Regarding methods of data synthesis for last part, data will be extracted from selected research articles and made available from the systematic review in the form of flowchart of whole process, data extraction table, and forest plot of the study by which the result part, that is of meta-analysis, is denoted. So that is a, in short, whatever my topic is, but it is a very big topic. The timeline of review, I've just given a rough idea. For development of protocol, it needs around 1 month. For systematic and comprehensive search, around 2 months is needed. Then critical appraisal of relevant literature, 2 months may be needed. For data extraction, around 2 to 3 months. Then data synthesis also 2 months. Then quality assessment and communication of result 1 month. So around 1 to 2 years is needed for a good systematic review and meta-analysis. But we can also do it quick systematic review if our team is more involved in this systematic review. But ideally, one year or more than 1 year is needed to complete one systematic review. So these are the references from where there is Cochrane Handbook of Systematic Review of Intervention that is available from internet, from where I have taken the content of my slide, and also with the help of another book by Essential of Biostatistics and Research Methodology by Indonesia and Bobipol. Thank you. And it's a very big topic. Everything cannot be covered in, and I also don't know many things. I am also in the learning phase. So thank you all for your questions here.
Thank you, Dr. Kaushik. Thank you. So any participant has any question, they can ask. And we have sent you feedback form. Kindly fill the feedback form and attendance sheet. Dr. Kaushik, we have 2 questions. Which is better, Covidence or Revman?
Better, I cannot say, but Revman is freely downloadable. So any new researcher, if you want to do a systematic review and they don't have any fund, they can download from internet Cochrane, Revman, and Covidence also. I think it is also good. It is very good, but for this, I think one subscription charge or some amount is needed. Better, I think, Madam Minushing Madam can tell.